Started our program in 2010, and we were initially only putting existing staff on apprenticeships for about the first year, and then in 2011 we started recruiting locally. That's because the trust felt there would be challenges in bringing inexperienced workers into the organization with regards to patient safety, and I think some of those apprehensions still exist today. But it has developed, and we've trained about 200 apprentices so far since then. About a third of those have been new recruits. So, I mean, but obviously with the funding changing last August, we're looking to have the majority of our apprentices as new recruits in the future.
I mean, I have to say our experience hasn't been particularly positive. You know, there's pockets of good practice, but certainly we've been involved in one trust where they tried to introduce apprenticeships, and it was a disaster, primarily because of the support they were getting from the education provider. I think there was like this view that because this higher education provider could provide degree programs for nursing and nurses and midwives, that providing an apprenticeship would be a piece of cake. And the other thing that we're finding very difficult is actually getting intelligence on where these apprenticeships are. There doesn't seem to be any national body that holds that data. And certainly we're now taking the view that we'll have to collect that data ourselves.
There is some myth busting to do around young people and their ability to work in care. I think I'm quite passionate about young apprentices. I think they've made an incredible choice that still is against the grain of modern kind of the opportunities that kids have, and I think we need to recognise that, and you can feel a positive energy from them. But what we hear a lot is that they require a lot of support.
With regards to existing staff development, that's another issue. I mean, prior to August, when the funding changed, there was a lot of people who hadn't necessarily done any training for some time, and the apprenticeship gave them an opportunity to develop their professionally. Also, the youth and the enthusiasm of youth can inject be infectious, if you like, in a department or an area.
Yeah.
I think one of the other things that we found as well is that when they're sort of halfway through their apprenticeship and they've gained some aspects of it, so say for example they've achieved their diploma side of it, they actually become quite protective of what they've got, and they're very quick to pick up on our existing staff when they're doing things that aren't done the way they have been taught. And our existing staff probably do it because they've got so used to their job. They sort of work on unconscious competence level, so they don't think anymore, and so they do things in a certain way because it's quicker that way. So it is a way of making our own staff, our existing staff, sort of sit up and think what they're doing as well.
I also think that, I mean, traditionally we would say, well, if we can get a healthcare assistant from 15, 20 miles away and they're experienced, that's better than growing your own. And that's been proven through our retention rates not to be the case. And we've found that recruiting locally and training is a much better way forward.
I mean, there's quite a lot of work going on at the moment, obviously related to Cavendish, etc. You know, what will come out and what fundamentals of care will look like, etc. And looking at how support workers are being recruited, employed, etc. And we're starting to, there are examples of trust that for the reasons you've just described are actually now working with Job Centre Plus, etc. And all of their new support work staff are being recruited as apprentices, where they're sort of doing 120 at a time.
Talk in Cavendish about apprenticeships was about having a higher apprenticeship that could get them into nursing, and I think that completely it was a complete missed opportunity. They should have been talking about advanced apprenticeships that kept people in those support, not just talking about bridging. And of course in midwifery you can't bridge, you have to do a 3-year pre-registration course. You can't bridge it. So I think that was a real missed opportunity.
There is something about valuing people for what they
Yes,
do,
exactly.
and fulfilling their potential to be the best that they can be.
Yes.
Yeah.
I mean, and in midwifery, as a consequence of programmes like Call the Midwife, One Born Every Minute, huge numbers of applicants, you know, often 1,000 applicants for 30 places in a university. So a lot of disappointed people ultimately. And of course that means that universities can really take on the creme de la creme, if you like. Very, you know, science A levels at A star, you know, they lots of experience. So a lot of people going through the apprenticeship system may not be able to compete against that.
I do agree, and I agree that not everyone who does even an advanced apprenticeship should go on to a pre-reg nursing course. But since nursing is all the AHP professions have become degree-level pathways only, I mean, aren't we losing out on some potentially good carers who haven't got 3 A levels?
But if they're working as internal support workers and in healthcare support, they are providing a really high level of care, and we need to be recognising that.
I don't think it should be either or. I actually think that we should value staff who want to stay in a support carer role and support them being as competent as they possibly can be, and be valued for the contribution they make for the team. But also, if they do want a pathway onwards to a profession, then that should be available to them. And I think for young people, it's interesting you refer to the television programme. For young people, their concept of the healthcare system does come from television. It comes from ER, and it comes from casualty, and it comes from midwives and so on. Certainly some work that I did with North Staff's Royal Infirmary, they had a very clear progression route with their local universities into the professions that they offered at the local university. And there were a couple of people that were really disappointed by not getting that, and they actually did an apprenticeship with the radiotherapists, and they've gone on now to do a degree in an area they would never actually have thought of, that was a shortage area for North Staffs, and they are the biggest sort of advert for the roles that they've undertaken.
I think the positive what we've heard today is that there are organisations like yourselves who are starting to embrace apprenticeships, and they are growing and getting better established, and they probably are the way forward. There has to be an acceptance that not everybody's going to agree, but as long as the good work's happening and people are benefiting, I think that's taking it where we need to.